Explain the history of the Halliwick Method and its role in the development of water-specific therapy.
Well, Halliwick is a swimming method that was once developed in England, and at some moment the physiotherapists and other allied health professionals, they recognized the value in terms of the effects on balance, equilibrium, posture control. And they developed this into a method or a concept actually which is called water-specific therapy. So nowadays we talk about water-specific therapy based on Halliwick. And the most important topic there is that you work on posture, trunk control, and that then is related to fall prevention. That's a very important topic. That also means that you not only look at balance in general, but try to identify in Halliwick or in water-specific therapy the most important problems in a specific patient. So that can be anything from not being able to dorsiflex the feet, so the goal then would be dorsiflexion of the feet, either through direct or indirect therapy techniques. And indirect therapy techniques means that we try to reactively facilitate dorsiflexion by using the properties of water. So by going into a pool, the constraints of the environment changes, and this is something that was realized by the founder of Halliwick, James Macmillan, already many years ago. Actually in 1950 he started with teaching children with a CP in London to swim, and the first thing that he saw is what they had problems with their balance, so based on the differences between land and water. And he, being a fluid mechanical engineer, realized that the big differences were in fluid mechanics. That means there was a mechanical difference between land and water, and these differences then have been developed into the use of therapeutic exercises based on the use of turbulence, waves, and once again metacentric effects. And metacentric effects are simply the rotational effects, the torques that exist because of the fact that gravity forces and buoyancy forces are not in one line. And you can use them to facilitate movement, or you can use them to stabilize joints. So being in water means that you are by definition unstable, but also that you are slow. So when you lose your balance, you have time to react. So the Halliwick idea, or the idea in water-specific therapy, is that you force the system, and the system is the neurological system, to react in those patients that have difficulties to react properly on land, because you give them more time and you make them unstable.